Good morning, my name is Will Felix, and today I'll talk about a little bit about the effects of caffeine, the pros and cons, some of the regulations established for athletes, recommendations actually for athletes, and what's the recommended amount of caffeine to be ingested on a daily basis based on recent research literature. So some of the pros of the intake of caffeine: it will increase the alertness and mood, even in relative doses. Equivalent to 250 milligrams of caffeine has been shown to stimulate alertness and improve mental performance. At 250 milligrams, some people report an improved sense of well-being, happiness, energy, alertness, and sociability. It also increases concentration and increases performance. Studies suggest that caffeine can help increase the performance in a variety of cognitive tasks, such as recognizing visual patterns more quickly. Some resources also note that caffeine allows athletes to exercise for longer durations of time without hitting exhaustion. And I'll talk a little bit about this as we move along this literature. It has also been established as a good tool for prevention of diabetes and some other diseases. The caffeine contains minerals and antioxidants which help prevent diabetes. It's actually been linked to potentially be a transporter of glucose from the serum into the cell. So hence the systemic effects of glucose are diminished because their concentrations in the serum are lower because of its capacity to transport it inside of the cell. Some recent studies from Harvard University has also shown to increase the cognitive skills, especially in people who already suffer from Alzheimer's. Some of the cons of caffeine: too much caffeine, it can be hazardous. Approximately 4 cups of coffee or more can be associated with an elevated blood pressure, elevated pulse, and all the systemic effects that can entail when it becomes more of a chronic issue. 2 grams of caffeine or more on a daily basis will perturb the emotional liability of a person, causing irritability, restlessness, insomnia, and agitation. It has also been linked to problems for reabsorption. There are minerals that can decrease its absorption, especially calcium, magnesium, potassium, iron, and other trace minerals. It has been suggested and proposed for endurance athletes, especially because they're always in search of a boost of energy for performance. Most often not, caffeine is the go for athletes. Caffeine may help actually metabolize fat stores more efficiently, enabling the body to use fats as a primary source of fuel. By utilizing fats as fuel, this allows the body to spare glycogen, which is an additional fuel source for the body to store in the muscles and in the liver. Glycogen sparing is most crucial, especially in the first 15 minutes of exercise. This is when caffeine can help significantly decrease the glycogen depletion. Some of the NCAA guidelines for the caffeine is as long as the concentration in the urine does not exceed 15 micrograms per milliliter, it's fine, which is basically the intake that any person can take on a daily basis. 1 cup of coffee a day. This should not be bad, should not exceed that urine concentration. For regular Joes and regular Janes, the recommendations of the daily intake of caffeine should not exceed 400 milligrams based on recent research. 400 milligrams of caffeine per day seems to be the safest quantity in most healthy adults. And even among adults, heavy caffeine use can cause unpleasant side effects. So the daily dose should not exceed 400 milligrams per day.